My name is Ulrich Keil. I'm professor of epidemiology and social medicine at the University of Muenster in Germany. My talk today was about cardiovascular prevention, a global problem. And I emphasized, first of all, the epidemic of obesity. Most of the people in the developing world and in the developed countries have know about the obesity epidemic, but they may not know that each increment of body mass index increase is connected with a decrease in life expectancy. So if you go from body mass index 25 to 27 to 29, with each increment of 2, you lose 1 year of your life expectancy. And that means that grossly obese people, compared to normal weight people, lose about 10 years. And that is similar to the smoking epidemic, where we also have a difference in life expectancy of about 10 years between those who do not smoke and those who smoke. And these are the major challenges for public health and for the prevention of cardiovascular and other chronic diseases. I also alluded to 3 other chronic diseases besides cardiovascular disease, namely chronic respiratory disease, diabetes, and another chronic respiratory diseases, diabetes, cardiovascular, and cancer. Cancer is a big topic, as we all know, because it comes in so many different disease entities. Well, what are we going to do? We have to improve our diet, our way of nutrition. We have to curb the smoking epidemic, and what is most important, we have to increase physical activity. And there is very good news about physical activity in that we know by now that not everybody needs to be a marathon runner or not even running 10,000 meters, but exercising and doing something of about 15 minutes a day. Moderate exercise like brisk walking, doing that for 15 minutes a day improves your health and diminishes mortality, total mortality, all-cause mortality by 14% and increases your life expectancy by 3 years. So far, we would always tell our patients and the public, you have to do at least 35 minutes a day, moderate, brisk walking again. This is fine. The more you do, not up to the marathon, as I said, but the more you do, the better it is for your health. But we should not discourage people who have 1 or 2 or 3 jobs sometimes and just do not have the time to exercise by telling them, you know, it doesn't matter if you just do 10 minutes or 15 minutes or 20 minutes, you can forget about it. It's not true. It's the old rule, I think, in biology that very seldom you have thresholds. It's a continuum. And the more you are doing, the better, but 15 minutes is already fine. And I think with this optimistic message of being able to achieve quite a lot by lifestyle changes, you can reduce your risk for diabetes type 2 by lifestyle changes by 90%, coronary heart disease by 80%, and stroke by 70%. And there is one wonderful example in the history of epidemiology and public health, and that is the example of Finland, the country of Finland, high up in the north of Europe. In 1970, had the highest cardiovascular mortality in the world. And my friend Pekka Puska took the initiative and really helped change. People have to change their life themselves, but you can help them to do it. And he persuaded the Finnish population to change their diet, to reduce smoking, abandon smoking, and do more physical exercise. And within 30 years, Finland became one of the healthiest countries in the world. So within time periods which are quite overseeable, within 30 years or even 20 years, you can achieve tremendous success when you take public health seriously.